Dr. Lindsey here. Today I'd like to share with you a talk that my son and I gave at the American Academy of Cosmetic Surgery, illustrating the success we've been having transplanting hair into scar tissue on scalps. So our talk is entitled Ultra-Refined Follicular Unit Transplantation into Scar Tissue as an Alternative to Surgical Scar Revision in Hair-Bearing Scalp. Scars show in scalps because of a lack of hair, a pigmentation mismatch between the hair and the underlying scalp. The scars themselves may become hypertrophic or even keloids, and if scars cross the aesthetic unit boundaries, facial appearance can be distorted. And an aesthetic unit boundary is something like the hairline or the eyebrow or the junction between the chin and the cutaneous lower lip. There's several etiologies of scars that we commonly see in our office. First and foremost are hair transplants done previously. Next would be removal of lesions such as skin cancers or cysts. The third would be failed scar revisions elsewhere or even at our office. Other cosmetic surgeries such as brow lifts and trauma. We have knife injury and a scalp avulsion in our series. The surgeon has three options to address these. First is scar revision itself, second is scalp micropigmentation, and third is hair transplantation. The advantages of scar revision is that it really rapidly eliminates the scar, and with minimal downtime you can make an attempt at least of resuming the natural anatomy in the scar-bearing area. The disadvantage is that people are often scared of additional surgery. There's no guarantee that a scar revision is going to work any better than the original surgery, because, as I've quoted many times, including in a couple other videos, the best guesstimate of a future scar is how did you scar the last time, meaning that patient variability and physiology play a big role. So if a person's a bad scarer, they may well not get a good scar even with the best of closures. The other downside is that with a very short haircut, most people don't want to have a second scar or take a chance of a worse scar. And finally, surgery can alter anatomic landmarks at facial anatomic junctions. So here's an example of a scar revision that we did, and we did it quite well. This guy had surgery over in Europe. It had a pretty wide scar. We excised this, got 1,500 grafts, and did a 3-layer closure. And he sent this picture in about 5 months out. But you can see that the scalp pulls quite wide open. That's my finger in the wound. And so it's critical to get a good tight closure so that an optimal scar can be obtained. And even with a good tight closure, sometimes scars still widen out. Scalp micropigmentation is really well marketed to the public. We probably get a phone call every other day asking about this. The trouble with SMP is that oftentimes it's only temporary. The ink can bleed, particularly in scar tissue, and despite the best efforts, the SMPs that we see here frequently have a color mismatch with the skin, or change color as the ink ages, or when the patient's hair turns gray, they're left with dark SMP dots. Hair transplantation, on the other hand, provides a pretty natural look and a permanent solution, but has the downsides of a limited quantity of hair to use. Patients may need that hair for future hair transplants, and again, anything with scars can be variable, particularly planting hair in dense scar tissue. Now, once the decision is made to do a hair transplant into scar tissue, you have two options to get hair. First is FUE. We directed patients to consider this when they had a history of really poor scars elsewhere, even with good closure, if they had a desire for a pretty short haircut, or if they were really scared of having an additional strip procedure. On the other hand, if hair was going to be removed by strip to use in a transplant elsewhere, we encourage them to use a strip to obtain the hair because it gives more consistent results. And again, if the patient needs more hair to use in a hair transplant at the same time, you can kill two birds with one stone. This is our patient series. We have 14 patients with at least a year follow-up. It's a diverse group of men and women aged 16 to 62. There's a variety of etiologies ranging from removal of skin cancer to a knife laceration to a fall with a scalp avulsion and previous craniofacial surgery. 11 of our 14 people had the hair obtained for transplant by FUE, 3 by strip, and the scars ranged from atrophic to firm to hypertrophic. In our series, all 14 of these patients had good to excellent results, and we didn't see any difference between strip and FUE grafts. Hair growth was slower, it took up to 15 months, and thick fibrous scars showed slightly slower growth than that. Our procedure really was tailored in 3 ways. First, we suggested strip or FUE based on the hairstyle desired by the patient in the future. Next, with grafts, we did very little trimming and left a little extra tissue around the roots than our typical hair transplant for male pattern baldness, and FUE grafts were not trimmed at all. And then we made slightly bigger recipient slits than we do with our typical procedure. With our standard hair transplant procedure, I make custom blades that are really just slightly larger than the follicular bulbs. With this, I probably made those 10 to 15% bigger so that the grafts fit in that dense scar tissue without the scar tissue compressing the roots. I'll show a few examples of patients. This young fella had a knife injury to his chin that was closed in one layer at an emergency room, and he's left with a fairly wide, slightly shallow scar without any hair. The next picture shows the recipient slits, and then the grafts are placed. You'll notice that his grafts are somewhat poppy, mainly because the chin is in constant motion. That did not affect growth. The left picture is him at 2 months, showing the grafts having been spread, and the right picture is him at 8 months with good hair growing out of the graft, out of the scar. He looks better. It currently is not in the country for photographs. This is a video of this patient. Our next patient's a middle-aged black man who had a strip procedure elsewhere and had a firm but not keloidal scar. We did 350 FUEs into the scar, and we saw him back at 3 years, showing excellent growth right out of the scar tissue. Pictures with and without the flash are shown for completeness sake. This European physician had a scalp reduction, which left him with a fairly wide scar and minimal hair growth along the edges. We did 1,800 grafts by strip, and then he sent these pictures in at 16 months, showing good coverage. Patient 5 is a middle-aged lady who had a chemical burn when she was a child that left her with a hairless patch just at her frontal hairline. She had 225 FUE grafts placed, and at exactly 1 year out she looks good. This patient had craniofacial surgery as a child and also had male pattern baldness in his frontal recession. Shown are his grafts placed into the craniofacial scar, and then his results at 22 months, showing a good hair growing out of the scar and a nice frontal hairline. This middle-aged European lady had had brow lift surgery in England and had 2 hairless patches at her hairline. We did 200 FUEs, and she sent these pictures in at 13 months, showing good coverage. Patient 11 and patient 12 were both young men, sons of a doctor who had had sebaceous cysts removed from their head. They were left with a fairly wide scar without hair. They then saw a plastic surgeon who did a Z-plasty on each one of these kids, which resulted in a fairly wide Z-shaped scar with no hair. We did 250 FUEs into each man, and this is patient 11 at 1 year. Patient 12 looks identical. And lastly, we have a young man who'd had a previous strip surgery and a failed FUE attempt to repair that, or to camouflage that strip scar elsewhere. We did a couple hundred FUEs, and this picture at 10 months shows hair growing right out of his scar. I suspect he'll continue to improve. He's slightly over a year at this point. And this is a video of our last patient. So in conclusion, hair transplantation is an excellent option for surgical scar repair in certain cases. FUE and strip procedures offered equal results in our series, and the key is careful graft dissection and placement will yield consistent results. Thank you. So I hope this talk made sense. If you have questions or would like to come in for a consultation, please give us a call. Thank you.